Good morning. Welcome to this 7th European Beer and Healthy Symposium here in Brussels. I'm really happy to see the so high level audience, and I think we can discuss about the health effects of moderate beer drinking, and I underline moderate. This is the key of our Congress, to be sure that the aspects we want to treat is for health for everybody, and the key is also always moderation. So when the organizers asked me to organize this Congress, I tried to gather very known researchers on beer and alcohol. I am Ramon Estruch. I am working in the hospital clinic in Barcelona at the University of Barcelona, and I have been working for more than 20 years on nutrition, Mediterranean diet, wine, and also the health effects of moderate drinking of beer. Another key members of the scientific committee is Dr. Hans Hendricks, who is in the Department of Human Physiology in the Netherlands Organization for Applied Scientific Research in the Netherlands. And we also asked Professor Augusto Di Castelnuovo to gather this scientific committee. His group has working very hard on the epidemiology of several foods, including wine and also beer, and has published a very good systematic reviews on this issue. And here we have one of his colleagues, Simona Costanzo, will talk about these aspects of the epidemiology and alcohol research. Franz Koch is a very known researcher also in human nutrition. He's working in the University of Wageningen in the Netherlands, and he will help me in the issues of this Congress. Patrick Mully, he is also working in the Division of Epidemiology and Biostatistics in the University of Brussels, here in Belgium. And the last one is another Spanish colleague. He's very known, Luis Ramon, who working in Las Canarias. It's a very nice place to visit in winter, especially in winter. But now he's in the weather of Brussels. It's not so good as in Canary Island. So we tried to gather the new aspects that people have been working on new aspects of beer and moderate beer, and the open address will be made by Professor De Bitte in the University of Louvain here in Belgium, and he's also a very known researcher on alcohol. I met him maybe 20 or 25 years ago when he was the president of the ESBRA, European Society of Research on Alcoholism. He has been also the president of the ISBRA, the International Society of Research on Alcoholism, and he will be the open address. And in the first sessions, we tried to analyze what could be the components of the beer that could be healthy, and we want to expect to analyze what could be a gluten-free beer, also the content of the fibers in the beer. And the last speaker of this first session will be Professor Lamuela, who's talking on the polyphenols on beer, and we think the polyphenols are a key nutrients on the healthy effects of diet. In the session 2, we think it's really very important to put the beer in the diet. We have making a lot of studies on Mediterranean diet, and we think that beer also can be included or may be included in the future in Mediterranean diet. And so Professor Veskens will talk on the eating habits in the beer consumer, comparing from the consumers of other alcoholic drinkers. This is an important issue, especially for me. Professor Grosso from the University of Catania in Italy will talk of his experience of Mediterranean diet at the adherence rates in Sicily, in Italy. And another key question when we talk about beer is about calories and what happened with body weight and the waist perimeter. So there are two speakers who are going to talk on this issue. The first, Dr. O'Sullivan from the Manchester, United Kingdom, will talk on beer and calories, and he's made a scientific review. And the last speaker of this session will talk on the effects of the beer and moderate intake of beer on anthropometric values. And the last session is the effects of beer on health, and Simona Costanzo will talk on beer and cardiovascular health, effects on morbidity and mortality. Professor Badimon, who's also very known research on cardiovascular disease, has spent a long time on the United States, but now we are lucky we have her in Barcelona, and we'll talk on the effects of beer on the heart, and I am impressed of the effects of little amounts of moderate of beer on heart. And the last speaker will talk another a new for me issue is the effects of non-alcoholic beer on respiratory tract health. After this, we will give a young scientific award for the best proposal we have been made, and we finish more or less at 13, 12, 15. I don't know. So, and this is just a very important reminder, and this is one of the key all the talks we're going to listen today. Always is moderation. We know that alcohol abuse and misuse is harmful and is associated with a very range of illness. So we're talking always of moderate consumption of beer by healthy adults. And we have to be aware that in some occasions, even healthy adults has not to drink when he has to drive, or the woman who was pregnant, or some people taking some medications. So you have to remind that we're talking about moderate drinking, always in a healthy diet. This is the clue. So we are going to move to the first speaker, and I told you is Professor De Witte from the University of Louvain in Belgium. Thank you.